I'm Vanessa Simon. I was born in Argentina, and my family immigrated to the US when I was 11 years old, and I have been living here since then. So I live in Delaware in the United States, and I will be sharing with you about how I've been able to use collaborations to create a sustainable arts and health community. So I began my business, Mariposa Arts, in 2020 after having piloted Healing Through the Arts 7 years ago. So that program began in 2017. With this program, I created a fiscal sponsor partnership, which allows me as a for-profit business to utilize the nonprofit 501c3 to apply for grants, things that, grants that would not be available to me as a for-profit business. My program has always been free to participants and the organizations that host us. We use a variety of art modalities with a mindfulness focus, encouraging participants to build their own creative practice. This past year, in 2024, I've been working on my newest project, which is a collaboration or collaborating as a consultant with the Delaware Division of the Arts, which is our government arts agency, and Veterans Affairs, another government agency. And together this coming January in 2025, we're launching a statewide arts for well-being pilot that will be serving the veteran community. Through this and other smaller projects, I manage all aspects of these collaborations. Additionally, I integrate my business as a change maker with other bigger projects. It was an honor this year to be asked to be a stakeholder for the Delaware Ship Coalition. They've developed benchmark for vital conditions of healthy communities, and they have a statewide plan to improve the health of the communities in Delaware. I'm representing the arts and health, and I hope to influence the arts being incorporated into the different vital conditions, because they're not right now. I'm making the case that the arts foster self-expression and lifelong learning, allowing us to make connections that combat loneliness and have a direct impact on our body and mental well-being. And they are a vital component of stress management. I'm also a member of local and national organizations, all in efforts to widen my sphere of influence. Some of these collaborations have been building for years. It has taken me, being really involved and an active participant in my state, attending conferences and calls for action. And I have long thought of myself as an ambassador for the arts and health, even before I had the honor of being chosen as a Global South Arts and Health Envoy. I candidly share about my personal experiences with, a health crisis and with the arts. And I also share what I get to witness around the art table with all the communities that we are working with. And there are art tables like this, where there's so much joy and conversation, and folks are sitting side by side, just creating together, but building a community for themselves. These are the different communities that I currently have the pleasure of introducing Art for Wellbeing to. I began Healing Through the Arts with the focus for cancer patients and survivors. We were later able to receive funding to expand to many others. Each one of these communities are treated with respect, with a human-centered focus. People are not commodities, not the participants who entrust us, nor the organizations who host us, and we treat the teaching artist with the same care. I believe that this is why my program has been successful. Community building takes time and patience and must be approached with a lot of humility. Deep listening must be exercised, and letting the communities tell us what they would prefer or tell us what they would like to experiment with. Working with youth was new to me, and as we expanded, I saw that many of them went from not being interested to looking forward to our classes. We provided consistency, respect, and gave them choices, allowing them to exercise their own agency. In this first photo that you see here, a participant at this particular workshop came in with considerable physical pain. And by the end of the workshop, they reported that making art helped them to forget their pain, which is not a small feat. I very intentionally design our workshops in ways that are culturally responsive to the communities that we're serving. The photo on the right, we have an expert storyteller visit our creative aging group for Latinos. And they brought traditional dresses and instruments from all over Central and South America and told them stories about the significance of each article to that particular culture. Los abuelos, as our group is called, the grandparents, expressed feeling so proud of our people and our culture. And all of this really began with me. When we are no longer able to change a situation, we are challenged to change ourselves. I love this quote from Viktor Frankl, and really through his book, Man's Search for Meaning, he has been a mentor to me. 10 years ago, I was diagnosed with the beginning of stage 3A breast cancer. This photo was taken at my last chemo treatment. This particular chemo was a year long. That's why my hair had already been growing back. Even in cancer, I challenged myself to find gratitude. I desperately wanted to survive for my young children, who at the time of my diagnosis were 5 and 7 years old. And I wanted to be here to live out my life with my husband. I slowly went from wanting to survive to wanting to live to wanting to thrive. As I moved from active treatment to management, I began to take one photograph a day, undertaking a 365 photo challenge. I didn't know when I began that it would morph into a gratitude practice. Each day, I looked to see something that I was grateful for. It often led me to take a walk, which has its own health benefits. And slowly, it moved me out of seeing the world through the lens of cancer. I began to notice colors again. I began to really hearing music and things again. It was not easy or glamorous. It was filled with fear, anxiety, and PTSD. And I needed creativity to move me through it. I began to think of my time in treatment as my metamorphosis. I knew I was never going to be the same after this experience. And writing, drawing, walking helped to gently move me from the cocoon that I was in into living again. I couldn't have guessed how beautiful that story would turn. Everything that wanted to destroy me became a way to transform myself and others. These partnerships was my way of turning my pain into something beautiful. We truly are better together. I realized that we are joining today from all different parts of the world with different resources, but I hope that my story sparks a glimpse of what is possible. When we work together, it allows us to utilize our individual strengths for the greater good. It consolidates our resources. It may help us in applying for funding to receive the funding that we need. It increases our reach and our sphere of influence, and we're better able to be culturally responsive in our programming. So some questions that I just would ask you, how can you utilize your strengths with those of a bigger organization? What resources do you have? You may not think you have a lot, but maybe you do. If you sit down and write them, you may discover that you actually have a lot of resources. How can you incorporate yourself into your local economy, government agencies, arts organizations, medical facilities? You do not need permission or wait to be invited. When I started thinking about these partnerships, I didn't know anybody in the government. I didn't know many people, but I made sure that I was a presence in my community. How can you use social media, especially LinkedIn, to become visible to people in power in your country, in your region, or your state? The truth is that they need you and your cultural competence. And if there's anybody here from bigger organizations, how can you uplift artists and community organizers? These are powerful questions that can lead to powerful outcomes. My program, Healing Through the Arts, now averages serving 1,800 people per year. But even if we just served one, it would be worth all the effort because it really makes a difference to each one. The arts and creativity are a powerful and transformational catalyst to bring about personal and communal change. And I believe this with all of my heart. We need medicine, we need research, we need caring doctors and nurses and medical personnel and therapists, and we need the artists and the culture bearers. Incorporating them into our healthcare solution diversifies the way we heal. It gives us ways of processing physical and emotional pain. It creates healthy outlets for stress management. And most importantly, it honors what many of our cultures have instinctively been doing for centuries. Since the beginning, humans have found ways of communicating. Creativity gives us visual and musical language for when words are lacking. It keeps the legacy of our ancestors alive and moves us into better versions of ourselves. Thank you so much for allowing me to share, and congratulations on finishing your fellowship. It's really an honor for me to be here with you.